Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you, Goeiemorgen, Molweni, and welcome to another episode of Life Matters, where we explore the journeys that shape us, the wellness to heal us, and the stories that inspire us. Today we're joined by Dr. Devesh Ramdani, an ear, nose and throat specialist with a focus on nose, sinuses and sleep apnea. We'll explore 4 critical topics that impact our breathing, sleep, and overall well-being. From the sounds of snoring and sleep apnea to the spinning world of vertigo and the persistent issues of sinusitis, tonsils and reflux. We'll breathe easy and gain insight from Dr. Ramdani's expertise, but we also want your interactions as well. So if you have any questions, comments, or any queries around your ENT, ear, nose, and throat, we have our specialist online. Please send us a WhatsApp or interact with us via our social media pages, and we hope to have Dr. Ramdani back on and deal with those questions. But let's welcome Dr. Ramdani in this ENT episode. A very good day to you, Doc, and thank you so much for joining us.
Hi there, good day. Thank you so much for having me. I'm really excited for today's show and I have a lot of information to share.
Awesome. And we did see a snippet of Dr. Ramdani during Ramadan, and he gave us some really, really good advice when it comes to the mouth and the breath, and some interesting facts as well. So thank you so much for sharing that with us, Dr. Ramdani. So let's get into it. Let's get into the ear, nose and throat issue and tackle snoring and sleep apnea first. Dr. Ramdani, what is the difference between snoring and sleep apnea, if there is any?
So with snoring and sleep apnea, we can sort of break it down into 2 categories. We can check the definitions within children and then check the definitions within adults.
Okay.
So snoring is generally a sound that's generated within the body and it's caused by the vibration of soft tissue. And this soft tissue can be anywhere within our air pipe or our breathing passage, and that starts from here and here. So if we have a blocked nose or we have tissue that shouldn't be there or excessive tissue within our palate or nose area, these vibrate when we try to breathe and they cause snoring. So snoring is actually a vibrational sound. When we talk about sleep apnea is actually an umbrella term and it incorporates a spectrum of disorders, and snoring is one of them. However, sleep apnea also can be broken into central and peripheral causes. So we can get sleep apnea from our brain, and then we can get it from the other passages that I was sort of talking about, like in the nose and the mouth, where those tissues vibrate and then give you snoring. But with sleep apnea, they encompass all the medical conditions that's related to sleep disordered breathing. And in children, generally, we have sleep disordered breathing where, excuse me, they suffer from snoring and sleep problems because they can't breathe. In adults, there's a few differences with sleep apnea and how it affects their body. And generally, we go through a sleep apnea syndrome period before we actually get to sleep apnea. So there's a few differences and technicalities, but I think in essence, sleep apnea really encompasses all the disorders that you have during sleep.
So, Dr. Ramdani, let's understand snoring. Is snoring a condition for sleep apnea?
It's one of the conditions that can lead to sleep apnea. So with snoring is just the vibration that happens, and it's the term to describe what's happening when we have sleep apnea, an episode of sleep apnea, and it can be one of the preceding factors that will lead to sleep apnea.
Okay, so these
So it's
conditions...
definitely one of the building blocks in there.
Okay, so with these conditions, how does it impact our overall health and relationships?
That is a very broad question, and I want to sort of break it down into children and adults.
Okay.
And let's start with children because, they're the future of our generation.
Yeah.
And I firmly believe, we should really look after their health. And sleeping is really essential to their growth and their development. And when we think about how the brain works and during development and growth, the brain actually gathers a whole lot of information during the day, and I'll concentrate on the ear, nose, and throat. So within the ears, it hears sounds and noises. We smell things, we build our immunity, and we taste things. So quite a few of our senses come from the ENT system. Within our brain, it gathers all of this information and then it has to put it together. When we go to sleep, that's the time our brain can lay the foundation where all this information becomes stored and set in the right places. When we don't sleep well, then that process is disturbed and that doesn't happen. So we may not be storing as much information as we get. We might forget some things. So, just in general, in terms of concentration and behavior, sleep definitely affects that in children, where it can affect their mood, it can affect their concentration level, and it can affect their memory. In terms of how it affects kids, the other very important part is their heart and their lungs. If we have to think about the nose and the throat as our air pipe system that brings air to the pump, which is our heart and lungs, and we block our nose or our throat, our pump really has to push hard over that resistance. And as a result, our pump works very hard and we don't get time to rest. And because of this, the heart is a muscle pump, and that muscle grows. And in children, it's not in a fixed cage or in a fixed system, our rib cage. It's still growing. So we can develop deformities of the actual skeletal system and the heart if we have severe sleep apnea. This only happens in severe cases, but within kids, for me, the three most important things are their mental development, developing their senses, and then lastly, preventing any serious complications that can impact them in their future health. In terms of adults, adults have a much broader, let's say, way that they get affected because in adults, all of our systems rely on our brain to function. So our brain's the powerhouse that gives all the instructions. And during our rest, unlike in kids where we're developing all of the stuff that we acquire in the day, as an adult, when we go to bed and we switch off at night, it's time for the factory to rest or the head office to sort of be switched off. When we don't switch off, generally when we wake up in the morning, we feel like we've run a marathon and we're actually quite tired,
Yeah.
but we've slept the whole night and then we're wondering what actually happened. Well, what happened is head office didn't switch off and we've just been so busy trying to stay awake so that we can breathe that we just don't have that time to rest. Besides that, within the brain, our memory is not as good as it could be. Sometimes, depending on the severity of apnea, one can have brain fog, and often, and I find this in practice quite often, just asking my patients in the morning, when you wake up, do you spring up out of bed and are you full of energy, or do you need a few minutes to collect yourself? And that generally just tells me yes, you had a really good sleep and you're ready to take on your day, or no, it wasn't so great and things didn't go so good through the night, and perhaps we can improve that because your body is saying it needs more. And if we look apart from the brain, and work our way down, our body produces hormones, and those hormones generally get feedback from our system, and our system tells our body we need more of this or less of this. When we don't sleep properly, the hormones and chemicals that we accumulate in our body definitely can cause problems that can be very bad for our health, and some of them are heart problems and heart attacks, and the other one is stroke. So it increases the resistance in our blood vessels, and that causes our pressure to go up. And we have blood vessels all over the body, and that's how those become damaged and can lead to those problems. Apart from the brain, some of the hormones in the thyroid, the chemical factors, the heart and the lungs, there are other systems that can be affected as well, like our gut, our renal system, and our bone health. And as we get older and we have sleep apnea, they can cause long-term problems. So in terms of gut health, we think about irritable bowel and disruption in the bacteria or the germs that are supposed to be there. In the kidney system, it can lead to kidney problems, but generally those are accompanied with other illnesses.
Yeah.
And in the bones, cause weakness in those bones. But again, that's long-standing problems. And then lastly, and one of the reasons that bring most of the patients to me is because of their sexual health. So many middle-aged men and women have problems with that aspect of life. And it's not only that they're not functioning properly, it's also that their partners snore and then they need to go to the next room so that they can just get a decent night's rest.
Okay.
It really is a problem, and
Yeah.
fortunately, we can help, and we solve that. So,
Thank goodness.
definitely
Thank
things
goodness
we
for
can
that.
do.
To the specialist ear, nose, and throat, they can help husband and wife stay in the same bedroom because one is snoring. But sleep apnea, oh my goodness, snoring and sleep apnea, this looks like a show on its own. But we're going to delve into some of the common symptoms, risk factors, how it's diagnosed with ear, nose, and throat specialist just after the short break. Dr. Ramdani, don't go anywhere. Welcome back. A very good day to you. Life Matters. And in this health edition, we're discussing snoring, sleep apnea, sinusitis, vertigo, and hopefully we can still get into the tonsillitis. But we'll see. If not, we'll do a follow-up show definitely. And that means that you can send your questions or any comments or queries around the ear, nose, and throat. And we can pose it in our next show for Dr. Ramdani to do a follow-up with us. Dr. Devesh Ramdani, an ear, nose, and throat specialist with a focus on nose, sinuses, and sleep apnea, and that's exactly what we're discussing still. In this segment, we will continue looking at maybe now some of the common symptoms around sleep apnea. Doc, just elaborate on risk factors and what the common symptoms are besides, not getting enough sleep because the head office hasn't shut down, as you said. And then, of course, not functioning properly. But what should one watch out for when it comes to some of the symptoms with sleep apnea?
With symptoms, I think the first thing is snoring, and that's the building block that kind of gets everyone worried. And, everyone snores now and again, especially if they're tired. Um, Sometimes there are other factors that can also cause snoring, so alcohol use and other drugs. And sometimes we even use those drugs medically, like sleeping pills and tranquilizers. Those can cause snoring, but snoring is definitely the first sort of sign. And one would notice that over time that snoring becomes louder and louder. And quite classically, my patients would sort of describe, oh, my husband snores like a tractor, or my wife snores like a tractor. That is really one of the most common descriptions that I get. And I think that should be worrying, that if the louder you snore and the sort of more people that can hear you, I think it does then should be concerning or worrying that something that shouldn't be there is happening, or something that shouldn't, be vibrating so much is, and why is that happening? But apart from that, Daytime sleepiness is also a very common symptom. So one would tell me I'm sitting and watching TV, and within 5 minutes I've fallen asleep. Then there's the more serious and dangerous side of that spectrum, where patients also say that while driving, I sometimes feel a bit sleepy, and
Oh,
then I want to fall asleep, and that can be really dangerous.
yeah.
But it does happen. As snoring gets louder and the amount of pressure we need to breathe gets more, this sometimes cuts off, and the body just can't generate enough pressure to give you that big breath. So we stop breathing. And when we have apneic episodes, and that's where we snore, and it gets louder and louder. And then at some point, it just cuts off and we stop. And then there's a big rush of breath, like a big breath in.
Mm, mm.
And those are apneic episodes or gasping episodes. And that is quite alarming. And if one has that, they should definitely get some help rather sooner rather than later. Choking and gasping on food while they're awake is also one of the telltale signs that something is not right within the muscles in this area, and that's why the choking happens. A dry mouth is very common. Often, also, the dentist would refer me patients because their patients grind their teeth, or often their mouth is dry and their teeth get chipped easily, so they have a lot of dental issues along with the dry mouth. Morning headaches, those are very telltale symptoms of sleep apnea or not such a good sleep. And then we have a lot of the other symptoms, which, I spoke about previously, where in children and in adults, it affects the different parts of their body. So, um, children are affected differently to adults. So with kids generally, we really look at how they sleep. If they wake up in the same position they go to bed in, how many times they use the bathroom, and things like that.
Okay.
With adults, apart from their sleep, we look at their overall general health, how they can function compared to their peers in terms of their energy levels, how quickly they can get up a flight of stairs,
Mm.
things like that, because those really help give us the guidance that you're getting what you need from the amount of air that you're taking in.
And often, you have those little telltale signs, but not realizing, and hopefully the show today will guide our viewers that they could possibly be suffering from sleep apnea. And then just check with a partner, how is my snoring? As you said, the gasping for breath, sometimes people do that or they don't, so that is a good sign to watch out for. Let's look at diagnosis. How do you diagnose sleep apnea? And are there effective treatments for this condition as well?
Very quickly, I just want to touch on the risk factors because I definitely
Yes.
believe some of them are avoidable and some of them are not avoidable. I'm going to start with the unavoidable one. Unfortunately, being male is a risk factor. Males um, theoretically have thicker necks or more musculature within their neck, which is why we're at a bigger risk of sleep apnea. Overweight and obesity, all our organs are coated in fat. So the more fat we have, the more fat coats all of these organs. And it makes the pipe or the airway pipe a lot smaller. So then our breathing then becomes difficult. I did touch on some of the drugs that we use. So sleeping tablets are a big one. They're one of the risk factors that are commonly used. Other social drugs, from the things we smoke to the things we consume in tablets and alcohol, those are major risk factors for sleep apnea. And then sometimes we have other medical conditions that can predispose us to having sleep apnea, like muscular problems or neurogenic problems. Um, I'm going to move on to the next question
Yeah,
in terms of
diagnosis. Yeah.
diagnosis. In terms of diagnosis, uh, someone has to watch you sleep, and fortunately we don't have someone watching over you while you're sleeping, because that's how it used to be done before, and they used
Okay.
to pick up body movements and restless legs and things like that. But fortunately now we have monitors that can do all of those things, and while the patient's asleep, we generally will monitor their brain activity, their muscle activity, the level of oxygen saturation, or how much of oxygen they're taking into their body, and their blood pressure. And with all this information, we can tell how many times the person stops breathing, or when they have trouble breathing, what their oxygen levels are during these times. And we quantify these and then would characterize them into normal or not so normal, let's say.
Okay, so about the treatment with regards to sleep apnea, the available effective treatments for those once they're diagnosed.
I generally always go down there's two treatment pathways. One is and one is surgical. In terms of medical treatments, this is where we look at maximizing all our efforts into decreasing the amount of mucus we produce, decreasing the swelling within the nose and the throat area. If there's reflux, we treat reflux. If there's any other neurological conditions or any other medical conditions that causes, we give medication to treat those. That's one of the first steps. And then with a second big part of medical treatment is something called CPAP, or a machine, or the sleep machine that helps you to breathe at night while you're asleep. This is very commonly used and one of the mainstays of treatment for sleep apnea. What the machine does is it provides pressure and oxygen so that we can breathe properly when the air pipe is reduced or it collapses. So it pushes the pressure and opens that pipe and delivers enough oxygen. Your other treatment option is surgical management. And with surgical management, we generally will look at the air pipe and the different places that it obstructs and decide on whether we can open that pipe, so make more space and get that pipe from a small circumference to a much wider one that we can breathe through. And we do that by physically examining the pipe and looking for any obstruction that we can remove so that we can make someone breathe properly. In terms of um, how we choose a treatment option, the patients generally dictate what we would do. So children get treated a little bit differently to adults. Adults definitely have a few more bits and bobs that we have to look out for that don't give them resolution of their problems. So, there's definitely a few more things that we look out for in adults because we need to modify a few more things. But with kids and adults, there are definitely medical and surgical treatments, and we do treat them differently. Generally, we start with medical or conservative treatment options. Sometimes we have to use a combination of both treatments in very severe patients as well. So, there's a few options available, and
Okay.
we definitely use all the things available to us.
Yeah. So after the short break, we continue our conversation with Dr. Ramdani, and we look at some of the lifestyle changes that can help sleep apnea and hopefully move on to vertigo after the short break. Stay with us. Welcome back. Assalamu alaikum. A very good day to you. This is Life Matters, as every Life Matters. And in this edition, our health edition, the Life Matters concerning our ear, nose and throat with Dr. Devesh Ramdani from KZN. And he's giving us some, pertinent information when it comes to snoring and sleep apnea. And a good way to go around that is also to just possibly check with your partner, your spouse, to ask them to watch you sleeping, because that's quite important when you are finding that your body's not working, the factory, the head office hasn't closed properly, as Dr. Ramdani explained. So please do interact with us. Your questions and comments really does make the show. We have our WhatsApp line and our social media pages are open. Before the break, we looked at the differences between snoring and sleep apnea, some of the conditions, which is a long list, that it impacts our overall health. It affects both kids and adults, the process of diagnosis, and also looking at treatment. Dr. Ramdani, I want you just to give us advice when it comes to treatment for snoring. You often see these ads pop up, and somebody says, or there's this ad that pops up and say, use this magnetic strip, over-the-counter little gadgets that you put up in your nose, the strips. What are the treatments for snoring? What helps with snoring, and does those little gadgets actually help?
That is a really common question that most of the patients that come to see me have tried and tested all of them. And I think my prof puts it very eloquently, and I keep repeating this even to my patients, that, when we have a solution for the problem, we don't have many options for that solution. So the more options you have, it just means that they don't work. And I think that they temporarily can give you some relief, but as a long-term solution, they may not be the best. Definitely, I don't advise self-treatment, because sometimes we may miss something that's really important. And I definitely think when it comes to sort of breathing's the essence of life. So I wouldn't really advise any over-the-counter nasal devices. They're really common. They're very cheap. They're easily available. You get different types, magnetic ones you can put on both sides of your nose, and it's said to hold it opened, and strips that also you sort of stick on here, and it holds your nose open while you sleep. But again, those are not long-term solutions to the problem, and they might help a little bit initially, but can actually make the problem a lot worse, because we're changing the way our body copes with the problem, and we might cause other issues in the process. So I think one must be really wary when using an over-the-counter device, especially to help snoring, and what the aim or what the hope to achieve is. Because if one is looking to rid themselves of snoring, I'm not sure if that might be the best option for them. But perhaps if it's a go-by treatment, so you're using it in the interim while you're trying to get what you need to, perhaps that's a little bit different. But again, definitely under the guidance of someone who knows about these type of things, because we really don't want to change the way our body works,
Now, Dr.
and land up
Ramdani,
in
are
problems.
there lifestyle changes that people can actually implement to manage sleep apnea or even snoring? I've heard some very interesting. I was in a conversation with a husband and wife, and the wife was complaining about the hubby snoring, and she actually says because the husband's snoring is so loud, she ends up closing up his nose because he's not breathing properly, closing up his nose, and now of course he's breathing through his mouth. Somehow, I don't know, he wakes up and then, or he turns. Does does those little antidotes actually help with snoring? And are there possible lifestyle changes that one can implement today before going to see a specialist?
Um, The patients really try it all, I must say,
Yeah.
from taping the nose shut to taping the mouth closed to pillows, propping them up on the side. There's
Yeah.
many things that one can do. And I think, there's no easy answer to say, can it help or can't it help? I definitely think there are things that can help, and there are definitely things that one should maybe not do. And I don't think the taping is one of them. I think taping should not be done. Um, but I want to focus on something that I think we take pretty lightly, and that's stress management and our work environment. So let's just spend a few minutes talking about stress and work. So we get to work, we're rushing to get there on time, we're meeting deadlines, we may not be eating properly, we're not hydrating ourselves well. To manage the stress, we might be smoking or not exercising because we're so stuck with getting our life going that, we're just, there's no time. So that essentially makes us a really bad manager of our stress. So I think, and often we overlook this because we just cope and we make small changes. And then in the end, when it accumulates and we have this problem, we're so stuck because we can't suddenly now change our jobs, change our eating, change how many times we drink water, and, stop smoking a whole pack of cigarettes a day. So, I think that if we're cognizant of these things as they happen, then we can put in plans in place to make it better instead of dealing with all this accumulated stuff when we're really sick, So I think stress management, you know, in children and in adults is quite important. Kids have stress in their lives. They want to perform well at school. They want to make their parents happy. They want to fit into the crowd. They want to be on social media. So they have their own stresses. And adults also, how this affects your sleep. I think, in short, it makes you a very anxious person. It keeps you awake at night and it prevents you from the act of falling asleep. So that's where I think stress management comes in. I definitely think eating well or healthily, getting your meals in, getting proper nutrition, getting hydrated because your nose and your mouth are mucous membranes. They need to stay hydrated. If we drink 5 cups of coffee and 1 cup of water a day, we are dehydrated. We're not actually hydrated, even though you're getting 6 cups of fluid in, So I think we really need to be aware of what we eat, being hydrated, following a more balanced and healthy lifestyle, because I think we take that for granted and we miss
Absolutely.
that. In terms of the environment we work and we live in, I definitely think that's something to think about. They can affect our nose and our sinuses. So at home, there's lots of things that can cause allergies like dust and things like that, carpets, lots of teddy bears, animals, curtains. There's a whole host of them. I
Yeah.
think there's definitely in the foods we eat, looking at the preservatives, because sometimes that can also cause issues. So, just in general, looking at managing our lives well is the first step of getting to better health. Managing the environment we live in, I think, is the second thing. And then the last thing that I'll touch on is keeping our nasal airway open, and we can do that by various methods. And then treat reflux if you do have it, and then treat the other illnesses that you have. So, if you do know that you have seasonal allergies or you do suffer with your sinuses, treat it instead of leaving it until you can't manage and then
Yeah.
trying to get on top of it.
Yeah. So before we move on to vertigo, because that's now the next step, the next topic of the discussion, is there anything else we still need to know with regards to snoring and sleep apnea, Dr. Ramdani?
I think the last thing that, I'd really like to say, I'm very passionate about breathing. I've done like 3 fellowships just on nose and sinuses and snoring. But if there's anything that I have learned,
Yeah.
and um, my mom's late now, but she would always tell me that I need to breathe properly and breathe through my nose and
Yeah.
practice yoga and not have my mouth open and stuff like that.
Yeah.
And the more I learn about breathing and the effects on our body as an adult, the more I appreciate and understand that breath is life. And if them works well, and I'm not saying that concentrate only on your breathing and making that better. But I think as a whole, it's a very important component of making the system work well. So for me, I'm very conscious and I empower my patients to also be that way. Just think about what isn't so good when you breathe, what's troubling you, do you sleep well? can it improve in any way? And, just by tweaking the little things, we really end up with getting a good quality of life. And at the end of the day, we all want that good quality of life.
Yeah,
So, that is my main thing is it really is the essence of what keeps you going. So pay attention to it.
mindful breathing in through the nose and out through the mouth, and just get a video and see the correct way of breathing, because often, like Dr. Ramdani say, and a reminder from his mom, who's not even a medical doctor, is, learn how to breathe properly. We're discussing snoring and sleep apnea. We just wrapped that up. After the short break, we'll touch on vertigo and sinusitis. Hopefully we'll get enough time to finish that. If not, we'll definitely have a follow-up show, so please do interact with us, and you can WhatsApp us your questions, but more just after the short breaks. Do stay with us. This is Life Matters. Welcome back, because every life matters when it comes to ear, nose, and throat. We have the specialist, Dr. Devish Ramdani, ENT, based out in KZN, with a special focus on nose, sinuses, sleep apnea, and snoring. As he said, he has, this very special interest on when it comes to breathing and people's snoring. So thank you so much for Dr. Ramdani affording us his expertise on this matter. We also would like your participation, so do send your questions if you have any for our follow-up show, because it looks like we'll definitely have one with Dr. Ramdani, our ENT specialist. So from the sounds of snoring to sleep apnea to the spinning world of vertigo is what we're going to discuss right now. We're moving on to vertigo. Dr. Ramdani, tell us exactly what is vertigo, what are some of the causes, and how does it impact our daily life?
Oh, that is a really tall order, but I think let's start with vertigo. And
Okay.
what is vertigo? And I think often one says, I suffer from vertigo, I have vertigo, I had an episode at some point, but what is it actually? Vertigo is the sensation of either the whole room that spins around us, or we spin and the room is steady. So it's quite specific, and there's other sort of words that we can use to describe the way we're feeling. The most common one is dizzy, unsteady, lightheadedness, or that drunken feeling as it's often described. But essentially, it just means that your world is moving and you have no real control over that. Um, and let's sort of think about with vertigo, what causes vertigo? How do we get it? When patients come to see me, they often just think, I have an inner ear problem. Please, can you sort it out because you're the ENT specialist? But if I have to think about the vestibular system, or the system that gives you balance, it's made out of different components. One is the ear, because the balance organ is within the inner ear space, and the nerve for hearing carries that information to the brain. Apart from the ear, the brain uses other information like the muscles. So our feet tells us how our muscles are positioned and tensed. Our eyes tell us what the environment is around us, and our reflexes, so all the nerves that connect our brain to all these systems, they all work together to give us or tell us where we are in the space that we are in, whether we're sitting, whether we're standing, how far things are away from us, whether we're moving forward or backwards. So the system's quite intricate in the sense that it gives us a lot of information about how we positioned in space. When we have vertigo, something has gone wrong within the system. And generally, looking at each of these components separately and together, we kind of figure out where the vertigo comes from, or how it breaks the system down to cause vertigo within a patient. And generally, we look at all of these things as a whole, when we're looking at vertigo, and it's not just from the ear, there are more
Okay.
systems that work together.
What treatment options are available for managing vertigo, Dr. Mdani?
Sure. In terms of treatments, I think it definitely depends on the causes of what causes your vertigo, and they're numerous. And we look at each of the systems, we get the appropriate testing, and then from there we look at. But in general, again, I have this approach with all of the illnesses. We have medical treatments, and then we have surgical treatments. In terms of medical treatments, we use tablets, and there are many on the market that we can use to treat vertigo. The TNC to this is that these are not long-term treatments. They don't cure the problem, but they help make the problem better. And if we have motion sickness or get onto the ship, we can take similar sort of drugs that help suppress the vertigo so that we don't feel so sick. Those, again, are not long-term treatments for vertigo. We generally need to treat the cause to get back onto our feet and allow us to do all the things that we used to do. Vertigo is very debilitating and very much like a system that learns something and repeats an action. When we have a problem within such a complex system, the wiring changes. So, when our wiring changes and we have vertigo, our body starts to think false things. So, it might think that the world is spinning, or our body is spinning, or our legs are not on the ground. In the meantime, nothing is spinning and our legs are on the ground. And how we treat this is rewiring the system. How that happens is we do some physiotherapy along with some medications, and that's generally enough to sort vertigo out. With persistent causes of vertigo, when we have middle ear pathology, then generally surgery is our treatment of choice. So there's a combination sometimes.
Can this actually be prevented or possibly reduced in vertigo episodes?
With vertigo episodes, how we can reduce them. So I'm going to give you a really interesting fact. Everyone over the age of 70 will have at least 3 episodes of vertigo before they're 75 years old.
Okay.
So what that means is this is a functional system. As it ages, it will not function as well as it used to, when we were younger. So what makes it better? What makes the system function better? Keeping our general health in check. So keeping the correct weight, keeping active, because we want all these systems to always be stimulated so that they don't age as quickly. It's very much like muscles. If we use those muscles, they grow big and strong. If we stop using those muscles, they stop working. And, if we think about how our body functions together, we need it to function in harmony with each other. And how we get that done is by exercising regularly, coordinating our movements, and that's what exercise essentially helps us do.
Okay. Can you share any success stories or case studies when it comes to vertigo? Because you often just hear about this problem, and one thinks, what are the solutions? Is this even curable?
Definitely, definitely, definitely. I think, cure is definitely there, and we need to quantify what is cure. So, let me give you the example of a patient that I had a few years ago. She was a lecturer, and she has had chronic vertigo, and she ended up seeing me a few years later after a vertigo incident. And again, we instituted multiple treatments. So apart from medical treatments, she had quite a few physio sessions. She had some audiology as well as surgery. And in 12 weeks, this patient was a whole different person.
Sure.
from not being able to stand in front of a classroom and teach and not complete a PhD, she actually moved quite quickly to getting back into lecturing, standing in front of, I don't know, 100 students and not feeling anxious or dizzy or not being able to conduct a class. It really helped in other ways. And, one of the things about vertigo is it does come and go, but it also does leave a lasting impression. And that lasting impression is often of fear. And that's the fear of falling, the fear of
Yeah.
getting into a lift, the
Yeah.
fear of going to a high space. So when we treat vertigo, treating these fears or the anxiety that might be attached to the vertigo is definitely one of the parts we focus on, and that empowers the person to then get back the quality of life that they used to have beforehand. Another very interesting story is with a rugby player. He's a kid that we had an injury, and then incidentally, we
Yeah.
found that he had a small tumor in his nose that was
Sure.
causing ventilation
Oh,
problems. We
goodness.
removed the tumor, got in the physiotherapy,
Yeah.
and he was on the A team, the A rugby team. After his injury, he stopped playing rugby, and within a year, he was back into the A team again. So there's definitely ways in which we can treat this, but we have to quantify these things and
Yeah.
we work towards the goal, and we
Absolutely.
definitely do these quite slowly because our system needs to also adapt to the new things that we're doing. So there's definitely treatments for them,
Yeah.
and patients generally do well. The last story I want to
Oh,
share,
sorry, Dr.
which was,
Ramdani. Unfortunately, our
are
time has run
you
up, and
okay?
this just actually means that those who are waiting on that story and then possibly a conversation on sinusitis has to tune into the next show. So a big thank
Okay.
you, a big thank you, and you can see the passion in this topic, in this subject that you have. So you, the ideal person to continue this conversation. We really do appreciate your time. Please just pencil us in, for a week or 2 weeks or so later that we can discuss this conversation. We'll follow up on the vertigo and then also sinusitis, which is a big topic of discussion. And then we can fall into tonsils and reflux and all of that. But it looks like a series we have to do here. So thank you so much for your time, Dr. Ramdani. All the best till we chat again. Goodbye.
Thank you, thank you, thank you. Thanks for having me.
Only a pleasure, only a pleasure. We rudely interrupted that lovely story that Dr. Devesh Ramdani was going to share with us, but we do appreciate him sharing his valuable expertise with us today, which definitely means we're going to have a follow-up show because we didn't even do sinusitis and the reflux and the tonsillitis. So do interact with us on our WhatsApp line, our social pages as well, to get your questions in for our follow-up show with Dr. Ramdani. May the wisdom shared on snoring, sleep apnea and sinusitis inspire us rather to prioritize our breathing and overall health. Thank you for tuning in. Until then, from the rest of the Life Matters team, wassalamu alaikum and goodbye for now.